So today we have is a panel discussion, and the panel discussion today is really around the subject of why medical professionals choose to actually work with us in dealing with their autoimmune disease. And I kind of think about it in this way. I was with my kids in Spain recently, and my son really wanted to have really good paella, which is a Spanish rice dish. And we started, I started going on my phone, duking around with it and figuring out like, okay, there's these reviews on Frommer's and this and that. All these were sources from, American reviewers. And what I found was that as I was looking at these sources was that, Americans or other people traveling might say that was good. But then I started to look and there was conflicting information. Like some of the locals was finding it that was like thumbs down. And so I was like, okay, so my son and I sat down, we talked, and we're like, what is the way to find out what is the best paella in the city? Well, we figured out, find out what the locals are eating, right? They're the experts. And that was really key to getting the best paella in town, because we started going around looking at restaurants that actually were serving paella, and we're like, which ones had the most highest number of Spanish people, the fewest number of tourists. And sure enough, we landed with the best paella in town. But why aren't we approaching healthcare in this way, right? I mean, a lot of times we're looking at, like, we're talking about dealing with autoimmune disease here, and all of us here are healthcare professionals here, and all of us are dealing with autoimmune disease. And what I really want to do is literally, take the screen off and have an insider's view for anybody watching this interview as to when medical providers, when we get sick with autoimmune disease, what are we doing besides conventional medicine? What do we do instead with our autoimmune disease to get different outcomes? So I think that's a really important conversation. That's why I've invited all of you guys here, because you guys are all medical professionals who've been through our program. And I'm going to have Frankie take this away so we can start the conversation of basically, where do the locals eat, which is, where do medical professionals go when they're struggling with their autoimmune disease? Why do you guys choose to work with us?
All right, guys. I would love for you guys to introduce yourselves. I'll start with introducing myself. I'm Frankie. I'm the nutritionist on the team that has been working with you guys over your time in the program. And I would love to hear an introduction from you guys of what part of the medical field do you work in, what has been your experience, and a little bit about your diagnosis. So Terry, you want to get started?
Sure, I'll start. My name is Terry, and I've been a registered nurse for about the past close to 20 years now. I am also a licensed massage therapist for the last 2 years. And I was diagnosed with ulcerative colitis when I was actually in nursing school. And we were learning about the digestive tract and all of the diseases that go along with it. And so I was devastated, because all I thought was, I'm going to end up with a colostomy and that's it, But things settled, and of course I went on medications and did all of that. And I just kind of dealt with it for the last 20 years. Along with ulcerative colitis came the irritable bowel syndrome, came migraines, hormonal issues, all things that I learned once I got going really went along with autoimmune. And I decided to start the program because my daughter was diagnosed with autoimmune just recently, and I realized that I was just putting up with it for myself, but I wasn't going to allow it anymore for the rest of my family.
Oh, Frankie, you're muted.
Thank you for that introduction, Terry. We appreciate it. Nancy, you want to go next?
Sure. I am Nancy. I got diagnosed with Hashimoto's in 2008. I'm a physical therapist, but I come from a family of lots of doctors. My daughter just started her 3rd year of medical school, and when she graduates, we will have 12 doctors in the family and 2 dentists.
God forbid.
Yeah, it's pretty nice, because you rarely have to go see the doctor. You just ask a family member. And I kind of got to, well, I did get to Maggie because a friend of mine who's also a physical therapist had seen her as a patient one-on-one. And I think the field of physical therapy is a little bit more open to kind of different approaches. You know, we tend to be pretty hands-on and trying to figure out sort of the nitty-gritty. My frustration with the traditional medical the medical community in my journey has been that everybody is very focused on their specialty. And actually, I was talking to my daughter about this this weekend, and what she said is, as people get more and more specialized, it's hard for them to back out and look at the big picture.
Yes.
So anyway, I probably wouldn't have gotten here if it hadn't been for my friend who had seen Maggie. But I mean, it seems like it's word of mouth, and we all know that there's more to it than just one quick fix. But trying to find somebody that, you know, understands that and is willing to look at the big picture has been very difficult. And I'm very grateful for having found this team, for sure.
We are too, Nancy. Thank you. And Christy, so your diagnosis and your role in the health field.
Yeah, so my name is Christy, and I am a comprehensive ophthalmologist, and I was in practice for 10 years. I actually left my job in 2015, almost, or just over 3 years ago now, because I have been on total disability, and I'm on total disability because of my autoimmune disease. I have rheumatoid arthritis, for which I was diagnosed in 2009. And then a couple years later, in about late 2013, I was diagnosed with Hashimoto's. And in late, like 6 to 9 months later, I was diagnosed with fibromyalgia. And after trying medication after medication and having multiple side effects after side effects, basically the last couple of years I've been limited to just one single medication, which is methotrexate, to treat my arthritis. And with that goes along all the side effects. I'd basically get mouth ulcers every week. And I have to do subcutaneous injections because it caused such severe nausea and stomach pains. And anytime I got sick and had to stop it, I had to restart it. I would have to start the dose so slowly that it would take me 18 months to get back up to the dose I was at because of the mouth ulcers. So anyway, this has been going on for years and years and years. And I stumbled across functional medicine and started learning more about it. And it just makes so much sense to me. So, basically the entire premise behind it. And one of the things that I've realized over the last couple of months, and especially, being in this program, is that I feel like conventional medicine, like the way conventional medicine sees success, is stopping or stabilizing health. Whereas, functional medicine and this program sees success as improving health. And that's just such a huge paradigm shift. And I want to be in the group that is improving health. I don't want to, because, by the time you get here, you've come so far, and just stabilizing your health, to me, isn't good enough anymore. I want to have some of my life back. And so that has really become just very apparent to me that there's this huge paradigm shift that I feel needs to take place. And so, so that was really one of the reasons I ended up here.
You know what's interesting is that, hold on, we're going to pause for a second. You know what? It's interesting when you're saying a paradigm shift, Christy, is that one of the things, I've been focusing on autoimmune disease from a functional standpoint for the last, 12 of my 23-year career. And one of the things that I noticed time and time again when I talk to people is that their experience of healthcare is that basically their assumption and the healthcare provider's assumption when they have autoimmune disease is this inevitable march towards worse and worse and worse. And that they're just basically doomed to a life of more and more suffering, more and more autoimmune disease diagnosis and death. And that's the underlying assumption. And you've seen as a result, you've seen people in our program where that's where they're coming from. They assume this themselves and their doctors assume this. So, I mean, and we're healthcare providers delivering medical care and we're part of this. We've done this as well. And so my question for all of you is going to be, why do you think the way that we train conventional medical doctors, nurses, physical therapists, why do you think it's, what is it in conventional medical provider training that has failed people with autoimmune disease? Why doesn't it work for people with autoimmune disease? Nancy, go ahead.
Well, I like I said, I had a long conversation with my daughter who is just finishing and just started her third year of medical school. And what I've observed and what she has said is that there is so much stuff you have to learn in medical school. And at the end of your second year, you have to take this big test. And it really, how you do on that test really has a bearing on whether or not you'll be able to get the residency that you want and where. And so there, and what she was saying is that the people who write these test questions are, you know, kind of the old school doctors. And so you are studying to those questions for this test. And so it's sort of, and you really only have so much time to, you know, I mean, you have so much information that you're presented with, and they really have to kind of just do the basics. And physical therapy school is sort of the same way. You know, everybody has to get all this certain basic amount of knowledge. And then, you know, then you go on to the real world. But what happens with medical school, in my opinion anyway, is that you start your residency, you've got a basic, not that it's basic, but you have this, you know, base of knowledge, and now you're focusing on more and more specific things, and there just isn't time to learn it all. In fact, I was talking to another person who's in medical school, and she was saying, and I was telling her, you know, it almost seems like you need to add another year of medical school so that you could actually slow down and take the time to look at a more global approach. But there just isn't time. And there's so much more knowledge now that you have to learn even than, you know, 20 years ago. And what she said was that they're actually talking about cutting back on the time in medical school, where you may be able to start testing out of some of the subjects. And so there just is not time to go through this kind of stuff. So
you're what you're saying is there just isn't enough time. But,
yeah, there's so much stuff you have to learn.
Yeah, but well, let me pose something. I mean, I went to UCLA, one of the top medical schools in the country. And, you know, when I look at it, how long did I spend out of my 4 years training in learning prescribed medication? At least an entire year. How long did I learn to prescribe surgeries and procedures? At least also another year. That's 50% of my medical school training was trained in that. But then when you actually look at disparity, how long did I spend on diet, nutrition, alternative medicine? Less than 30 minutes in my 4-year career.
Yeah.
Maggie. Same way with nursing. Holistic approaches to nursing school were, it was a 3-hour part of a 3-hour lecture out of 2 years of training. That's it. No one is interested in a holistic approach because it doesn't favor big pharma. It doesn't favor surgeries. It doesn't favor where, to me, in my thought process, it doesn't favor where the money goes.
Well, and I think also, you know, people are taught that you have to look at, you know, the studies and how the studies were done, and they're manipulating maybe one little tiny thing, but who's paying for these studies? And you know, so the doctors are saying this is bogus because it wasn't, you know, wasn't a big
if you
study.
think about some of the biggest drugs, I mean, who's funding the studies? The people who profited from the most. So drug companies are, and so all the studies are around drugs, right? So if you think about it, okay, let me just say food mapping. Who's going to actually spend, I don't know, $1 million on a study to show that food mapping works when no one makes money off that?
No one.
Does that mean that it doesn't work? You guys have experienced this. You guys have all done food mapping.
Mhm.
As medical professionals, does food mapping work? Does it provide outcomes?
Food mapping for me was huge. It changed it changed how my digestive tract felt, how it was reacting, how I felt, how my joints started to feel. I finally understood things that were bothering me and why. And food mapping was a huge part of that for me.
Yeah, but they're going to tell you there's no data behind it.
Well, they can tell me that, but I know how I felt and how I feel and how I
Outcome.
feel. Right, correct.
You got outcome. That's evidence right there,
Yeah.
right? So, Christy, I noticed you were a couple times you were about to chime in about medical school training, nursing school training.
Yeah, I guess what I was thinking, I was thinking more kind of broad-based in that that I just don't think they perceive that they can do better. Like, I just don't think they think, I mean, I think they really do think they're doing the best that they can, that they are providing a service, and that there isn't an alternative. And it's just through programs like this and the success and the results people are seeing that that they'll be proved wrong. But that's what I believe. And of course, what you were just talking about with big pharma and large corporations funding the studies, that just plays into that whole scenario. But I think that they just don't think that I don't think they think there is another option out there.
Mm-hmm.
So let me ask you guys. I mean, all four of us have had autoimmune disease, and all four of us has chosen an alternative route of dealing with our autoimmune disease. So my question for each of you is, what compelled you to choose to work with us? Why work with us? I mean, you have plenty of people in the world to work on, plenty of specialists for every little target organ that you had symptoms with. Why did you decide to go out of the box and actually work with us? Terry?
I liked that you were looking at me as a whole, as a whole being, not just one area. It wasn't going to be just my digestive tract. You were looking at the triad. You were looking at the whole picture, at my hormonal levels, at my thyroid. You were looking at everything, and things that I felt for a long time were out of whack, but have been told
We're not related.
Right. And that
like what? Like what, Terry?
Like with the hormones, estrogen and progesterone. When my doctor said, "Oh, you're in menopause, so let's put you on a patch, and because you need more estrogen." And yeah, and at the time I didn't even realize like that he when I looked at my lab work later, I realized he never checked for the progesterone level. All he checked was the estrogen level, and then come to find out, I'm in the tank. I had zero progesterone, almost no estrogen, but I felt horrible on this patch, and it was because I needed more progesterone, not more estrogen, that I learned from your program.
It's hormone balance. Oh, doctors and nurses are not trained in hormone balance.
But this was an OB or a GYN, doctor. So it was like, I thought, if it's not even coming from him, where am I going to get this from? And that's why I thought, I'm giving you a try, because I want to be looked at in a holistic way. That's how I want to practice in massage, doing my energy work, and that's how I want to be looked at as a person in the medical field. I want to be looked at as a whole, and I want to come off all of these drugs that I can't stand being on.
Well, what I'm hearing is that what you're saying is that this is the kind of care you'd want for yourself. So
Absolutely.
As a patient yourself and as a recipient of that care, you're choosing to go a different route as a medical professional.
Absolutely. For myself and for my family members, because I want to educate them as well. So absolutely, yes.
Okay. Either of you, Christy, Nancy, let's go into why you chose to work with our program instead, knowing all that you knew.
Yeah, there were a couple of reasons actually Terry just brought up. One of my big reasons, which is, I've just entered perimenopause over the last year and a half. And the trouble and difficulty that I've been having with that since it started literally threw me over the edge. After 3 autoimmune diseases and then, this coming on and it being so awful. I hit my wall and my breaking point, and I said, I cannot do this anymore. And of course, just like Terry, you go to the provider and they trial and error, try this medication. Okay, that doesn't work. Try this one. Okay, that gives you side effects. Okay, try this one. None of it is database. None of it is, it's all just trial and error. And I just can't live like that anymore. And so that was one of the big reasons that I decided to work with you in your program. And the other one was the testimonials that you do, because, I realized that there were other people out there that had done what I was doing and had the same results that I was getting. And then they went through your program and had completely different results. And I thought, and there was somebody that was just like me. And I thought, well, gosh, if they did it and they're getting these amazing results and they have, and they're experiencing exactly what I am, why wouldn't I have similar results? And so that was really powerful for me, those testimonials.
Well, what's interesting on the testimonial front, just so you know, is that some people think our testimonials are fake. That they're paid actresses. And that you three right now are paid actresses.
Where's my check?
Yeah.
Where's my check?
Yeah.
Yeah, right.
Come on, Maggie. Come on.
I wish I could be a paid actress pretending I had autoimmune disease and I turned around.
Right.
But it's interesting. So what you're saying is that you wanted different outcomes for yourself, Christy. You saw other people with outcomes and you're like, I'm a medical professional. I'm smart. I'm scientific. I'm an MD. Why can't I achieve these same results and outcomes? And then the testimonials are really important because that was proof to you.
Mm-hmm.
And then you experienced the program, yourself. So those are 3 compelling reasons for you. What about you, Nancy?
Well, for me, I did go the conventional route. I got diagnosed with Hashimoto's and I went to an endocrinologist who, put me on a thyroid medication and then was content with my numbers, even, my lab numbers, even though I still wasn't feeling any different. And so then I had a sleep study. I went to the allergist. I was ready to actually go to GI doctor because I started having more and more GI symptoms. And then I found out about your online training thing, and I, went and watched the free
Training, yeah.
Yeah, the free training thing, and it was like, I did go the conventional route, and I still felt terrible. So I knew there had to be a bigger, more global, way to approach this. And then after watching that, it was like, okay, this, to have somebody look at the entire picture for a change instead of just your thyroid or just your stomach or just your whatever, was essential. And having done a bunch of research on my own too, I knew that there were, I knew there was probably a food component and I knew there were probably other things, but I just, there's so much information out there that it was hard to try and figure, I tried going on elimination diets, but I still couldn't figure out what food it was. And so to really have someone be able to kind of go to the core of what to look at was.
Nancy, that's a good point. It's really hard for people out there to believe that food mapping actually works, that there's a blood test and there's actually a process that we have that gives you extreme certainty and clarity about which foods is triggering your autoimmune attack. So I'm going to ask the 3 of you, is this real? It's food mapping and the results real.
Mm-hmm. Very much.
Absolutely. Absolutely.
And then number 2 is, what about hormones? Getting labs on your hormones, understanding the patterns related, the most common hormone patterns associated with having autoimmune disease, and figuring out what's causing that and how to treat that. I mean, how important was that to your turnaround in your autoimmune disease?
one of the first biggest things for me.
And very big for me also, extremely helpful.
So I want to just go over a couple things, which is like, you know, a lot of times when we're looking at the outside and we see all the Spaniards and they're eating paella, we want to check out their paella. So I'm going to ask you guys, I mean, if there was one or two amazing outcomes that you had out of this program that you didn't even expect coming in, I'd like you to share what that is. Because one of the things I realized was a lot of people come from the point of view where they're like, you know, there's data that Humira works. And so I want to know the exact percentage of people at week 4 who's off your program, who's in your program, who's off their meds by week 4. And, you know, they want like a specific set of piece of data that somebody's better. And it's really difficult. And I tell people, like, sometimes the outcomes that you get is like totally not even what you imagined for yourself because you had no clue it was even related with your autoimmune disease. So it's always surprising when I ask people the question, what is an outcome that you would say was major but unexpected, not even what you anticipated in coming into this program? Any of you can chime in.
Mine was, I had no idea that the difficulty I was having with perimenopause was related to my autoimmune disorder. I mean, I was like, how is this possible? I was thinking to myself, I already have 3 autoimmune diseases. I'm on total disability. I can barely function. And now I have horrible, horrible, horrible perimenopause. What are the chances of this? And it never, ever occurred to me.
Causal.
Of course, it's absolutely all connected, of course. And that was like mind-blowing to me to acknowledge that. And then it made such perfect sense. It's like, well, of course, it's all connected. Everything is connected to everything else. Of course, it's all related. And then what I learned in the program about how and what to do about it is just like completely life-changing.
Well, it's data. It's also didactic learning about what the data means. And then number 3, mastermind calls where we're in a live group like this, troubleshooting. I mean, so now you really understand what are those patterns and then what the hell's causing it and what to do with it. I mean, mastery is something that we don't hear about. I mean, who the heck, what MD do you hear out there? What medical clinic setting is where the goal of their program is actually to teach patients, clients, like real lay people, mastery of autoimmune disease?
Well, the other thing that was fascinating to me is how it doesn't matter what your autoimmune disease is, but you know, you have to look at all the same things for everybody. And just going through the program, watching people with, you know, all kinds of different diagnoses, all getting better. It was, I mean, shocking, really.
I think it's a lack of understanding of patterns. Like for me, it's like, I think people out there, because I mean, I think it goes to your point, Nancy, where everybody in medicine is getting more and more specialized. We have our specific niche. So what you see is more and more people getting more and more specialized, and also patients with autoimmune disease thinking that they're more and more of a rare zebra. So they got to find the specific zebra doctor that's going to know how to deal with their specific zebra problem. But the problem is it doesn't matter which targets are under attack. The real problem is Godzilla, which is who is causing the autoimmune attack, the autoimmune disease itself. So for me, it's really simple. What is it going to take to stop feeding Godzilla? 5 things. And if you deal with these 5 things and you master these 5 things, which is blood sugar, hormones, food mapping, infection, and vitamin and nutrient status, if you master these 5 things, you can stop feeding Godzilla. And who cares what Godzilla is attacking? They're all going to be decrease, decrease, decrease. So it simplifies it. It's actually a very elegantly simple solution to a very difficult and complex problem. Mm-hmm. And I mean, you guys can attest to this. How many people with different diagnoses were there in the program?
Oh, lots. I mean, 20, 30, I mean, all over the place.
And how many had multiple diagnoses?
Lots.
And how many people got better?
Everybody. Everybody.
Everybody. And that was the other question some people ask is, are your outcomes unique? Like, are you 3 superstars?
No. I mean, yes, I'm a superstar.
Oh, yes.
No. No. Hormones was a huge huge for me. Learning how to deal with that and how much they were affecting, as like Christy said, I was amazed at how much they were affecting my autoimmune, and the food mapping was huge. I had gone gluten-free about 4 years ago, and I knew I was feeling much better, but I still wasn't feeling great. And there was a reason for that, because I was still ingesting foods that were bothering, dairy and cane sugar and things that the food mapping brought to light that I was just stunned by.
Well, you're stunned because here's the thing is when you actually Google diets that help in RA, let's say, or Hashimoto's, you're going to come up with like 90,000 results, all of them contradicting.
Oh, all over the place. Yeah.
I mean, we're medical professionals, and
Yeah.
we think that's asinine and confusing as hell and overwhelming as hell. Think about the lay person who's not medical professionals. And then to me, let's just cut through that and say, what's a blood test that's going to actually identify for you? What's the process which we can teach you how to actually have clarity, certainty about that, and then are you getting outcome once you've actually applied those principles and your lab data to you? And all of you are like, yes, yes, and hell yes. Right?
Yeah.
Okay, so I want to ask some of you, because this pertains to you, all of you in the medical field, and I think Terry alluded to this. How has your experience in the program changed, I guess, what your trajectory of what you want to do with your career? Has it changed or modified it in any way?
I can answer that. First of all, I honestly can't ever picture myself going back to the type of work I did or the practice that I had. And, I think there's several reasons for that. But one of the big reasons is, now that I've learned about, the differences between conventional medicine and functional medicine just makes so much more sense. And it's the first time that since I left work over 3 years ago, that I actually thought about maybe this is something I could do. Maybe I understand this makes sense and this works. And I feel so bad for all the people out there that don't know that something like this exists. And you feel like you just want to, shout from the rooftops and tell everyone about it. And so that makes me feel like, I want, that how can I be useful? How can I take this information and help other people? And that's when I started thinking about, possibly going into this line of work and doing something along the lines of functional medicine. And I had never previously thought about anything even remotely along those lines. So that was a huge mindset change for me.
Me too. So, same story for me was that when I applied these principles to me and I was able to completely turn my life around, you become a hypocrite. You can't go back to just writing scripts and telling people to get surgery and medication.
Right.
I can't be a hypocrite after this. It becomes like literally your life's work because it literally transforms your own life and your own health. I mean, this completely changed the trajectory of my life. If I was going to continue with autoimmune disease the way it did when I was 36, I'd be dead by now. No way, no how. Not on my watch, not on your watch, right? So that's a commitment I made to me, and then as a result to my patients. And Terry, you were about to say something as well about career shift for you. Oh, you're muted, Terry. Let's unmute you.
Sorry.
Go ahead.
I find that with a lot of clients that come to me for massage, when they know that I'm a nurse and that I used to work in nursing education as well, they start asking a lot of questions, and they trust what I have to say to them, and they want to hear what I have to say. So I take the opportunity to talk to them about looking at things more on a functional level and looking at things holistically, and there's this program I just did, and I talk a lot about that to the clients, and those, especially those who ask and they want to know things, and they want to know how I've done things, and they thank me because they're interested in, and I find that synchronistic events happen. I don't believe in coincidences. Just like it wasn't a coincidence for me to find your program, it was a synchronistic event. And when I'm asked questions from clients, it's the same thing. And it's my opportunity to give back to them, to hopefully lead them towards you in the program and their health and them finding what works for them. And I love that part about my job. I love being able to give that back to my clients. And honestly, if I were still in nursing on the floor doing that, I don't think I would have that opportunity to do that. But in my own private practice and doing massage and energy work, it fits, and I'm able to do that, and I love that piece.
That's beautiful, Terry.
Thank you.
Nancy, what about you? Do you think it's modified or changed your career in any way?
Well, I mean, with physical therapy, we get to be pretty one-on-one with people for more of an extended time than a typical 15-minute doctor visit. But I think mainly the change is just, now knowing what to tell them to look for when they're trying to find a practitioner. I mean,
what should they look for?
Well, I mean, you want people that, look at the functional values and not just the normal lab values. Right. And, finding doctors that, will work with you and not just tell you what to do and that kind of stuff. And we learn all that in the program, which is, super valuable information. I think one of the problems with conventional medicine is the short time that you get with each doctor. And it's just, I mean, you can't possibly look at the whole big picture in a 15-minute visit. And I'm hoping that as more and more, there are more and more of us that learn how, the big picture works, that we'll start demanding more and more from the conventional medical community, and hopefully we'll see a change. But
I think you're right, Nancy. I think that the drive towards functional medicine approach to autoimmune disease is literally grassroots, and patients are demanding it, and they're also investing in that kind of care themselves. I mean, this is not stuff that's covered by insurance.
Yeah.
But what's cool about us is we know what the heck insurance covers, and we know that the outcomes we want in our lives sure as hell is not going to be limited by what insurance is willing to cover or not cover. Do I sit and say happiness, being at my daughter's wedding, is something that my insurance gets to determine whether I'm going to be there or not?
No.
Yeah.
Hell no. Hell no. And so for me, I mean, it really is a grassroots movement from patients. And then I do think that as healthcare providers, the four of us in here and all the other healthcare providers that are in our program that's been through the program, I mean, we all say the same thing. I mean, is that, moving forward, I mean, is that, we have chosen for ourselves different outcomes, and we've gone outside the box to do a different paradigm to create those outcomes. And it's become our passion and an imperative for us to communicate that to other people, because we know how asinine the system really is.
Yeah.
Our paella looks really good. Well, okay. Any parting thoughts for people who are on the fence, for people who are not medical providers and they're looking to you? Do you have any people who are on the fence? Is this for reals? Is this fake? What is one piece of advice you can give to anybody who's on the fence about joining our program or a full board investing in a functional approach to their autoimmune disease? Any sort of advice from the three of you?
I think a big thing that I have come to realize, and I'm sad it took me so long to get there, but, and speaking in terms of mindset, I had a huge mindset change in regards to acknowledging that finally that I needed to take control of my health myself.
As a doctor and as a patient.
Yes, and that was it took me 10 years to get to that place. And that's because, I trusted my physicians and I trusted the system, and it completely let me down, and I learned the hard way. But I'm so grateful that I got to this point, because you really do have to take control of your health, and you can't just sit around and assume somebody's doing the right thing for you or the best thing for you. They might think they are, and their intentions are good. It's not that they're bad people, but that isn't necessarily the case. And you really do have to be your own health advocate and educate yourself. And, knowledge is power. I mean, that is just like, and so going through this program and learning, everything that we learn, like, you can't unlearn that information. And so this is invaluable, especially when you have a chronic health condition that you're going to have for the rest of your life, to be educated on the tools that you need to get better, and the tools to navigate the system. It's invaluable. But I had to have that shift in mindset where I stopped waiting for somebody else to improve my life or to improve my health. And I decided I needed to take that challenge on myself. And so signing up for this program was a manifestation of that mind shift that took place.
That's beautiful, Christy.
Mm-hmm.
Anyone else?
Yeah, well, for me, I just look back. I got diagnosed with Hashimoto's in 2008, so 10 years ago. And I can't tell you how much time and energy and money I've spent trying to feel better. And finally in 8 weeks, all the light bulbs went on, and
8 weeks.
Yeah.
8 weeks, people. 10
Yeah.
years, 20 years of struggle. 8 weeks.
Yeah.
It's real. Yes. Finally, after 8 weeks. Yes.
Yeah. Yeah. I mean, it's, and, like Christy was saying, having that knowledge, you're not going to unlearn that. And, now you can go in as an informed patient and, know what questions to ask and know when you need to find a different provider.
Mm-hmm.
Mm-hmm.
Powerful.
And I'm going to mimic just basically what the girls just said. Education is the key. No one can take that away from you. And the more you educate yourself about your health, your body, how it works, and what is best for you and your system and what is going on with it, the better off you're going to be. Because even as having my nursing education and working in nursing education, I didn't have enough knowledge until I got into the program and saw how you looked at things all pieced together to know how to really ask the questions and how I needed to look at things. And that really blew me away when I realized that wow, I still am learning, and I think that's the key. You can't take that away from you.
That's beautiful. And a lot of people too, we're so used to the co-pays in healthcare, and we're thinking like $20 or $30 copay for this or for that. And we don't realize how limited we are by the outcomes that the whole system provides for us. So one question I always ask people was the investment in the program worth 10 times more than what you actually even put into it? I'm going to ask you that.
Yes.
Yeah, absolutely.
Yes.
It was.
Yeah.
I just wish that I had, found it sooner, because, I spent money for 10 years getting nowhere.
Well, that's the most expensive thing, when you spend the money and you don't get outcome.
Yeah.
Yeah.
So here's an obvious outcome, and yet people still hesitate with that because they've been burned so many times not getting outcome. And so for me, like, you guys really lend a lot of credibility with your own experience and your own training to what this is really about. This is about new outcomes in your life, and they're real. You guys are not paid actors and actresses.
Well, and you can't put a price on your health. I mean, that's, to me, it's like, how do you put a price on that? It's just, and how do you put a price on being educated and becoming knowledgeable in your disease, and, what you can do to make it better. And to me, it's just really hard to put a price on those things.
Let me ask you then, what about, can you put a price on the level of power that you feel moving forward in your life? When you say knowledge is power, to actually own and have certainty and have clarity about what your path is and how you interact with your doctors, what tests you need and don't need, have discernment in the level that we're talking about as an outcome of this program. Can you possibly even put a price on, when you say knowledge is power, Christy, how can you put a dollar amount to that?
You can't. I mean, it changes the entire relationship, because then, as I was saying earlier, you become your own advocate. You are fighting for yourself. You're not sitting there waiting for somebody to make decisions around you. You're part of the decision-making process. And how can you be part of the decision-making process if you're not armed with information to support your message? And so without having the information, you really can't play an active role in that relationship, that patient, provider relationship. So you have to be educated, and that you can't put a price on that either.
So I think that's really cool, is that I think the people out there don't understand that even as medical providers ourselves. I mean, you're an MD, I'm MD, we got nurses here, PTs here. None of us got this training. None of us are even with the best of intentions could have provided this care and these outcomes. So I think you guys are living testimony to the fact that these new outcomes can happen. The mind shifts have happened for you guys. These outcomes are real. I want to thank you for all four of you for sharing, really candidly, personally about your experience. And the hope that we have here is, you're saying, Christy, you said, I want to shout from the mountaintops to people. Mm-hmm. And that's what I felt like as an MD, having gone through this process myself and now delivering care in this way, that this is real and this is out there, and I was hoping that we could have this conversation, because that's what a lot of people have asked for. Mm-hmm. Can we actually get an insider's guide? See what the locals eat.
Maggie, I think you have to get sick and tired of feeling sick and tired. Mm-hmm. Then you're ready to move forward. Mm-hmm. Then you're ready to take on the program.
Yep.
Yeah. I do think that was it. Oh, sorry, go ahead.
No, I'm done.
We're ready for you, Nancy.
Well, I'm Maggie, I said it on our graduation call. I'm going to say it again. I think you need to give seminars to the physicians. I think there are a few out there that, have an open mind and would be willing to learn. They just don't know this information, to apply to their own patients.
Christy mentioned something like that as well. And that was the thing is, should I provide this program to actually train physicians how to deliver this care? And honestly, it's a sad state of affairs, but I can tell you this right now is that how we, and Nancy knows this because your daughter's in med school, but how we train our physicians right now is literally anti-root cause approach, anti-looking people as whole people and systems, anti not making money for big pharma. It really is. And so for me, I do focus on actual patients and people, boots on the ground, because you guys are, and you guys happen to be medical professionals, but you guys are more likely to actually really experience the pain to actually make these changes. And the only reason we as medical professionals, the four of us here on this call, is because we experience pain to the depths of level that a few people can understand, that we're willing then able to do that. Physicians who don't experience this level of pain and suffering, there's very little incentive for them to do this.
Yeah. My gastro guy just doesn't believe in gluten-free, doesn't believe in,
he'll say there's no data behind it.
Yeah, just eat what you want, he says. Yeah, so what if you have to just eat what you want? Well,
does that even intuitively stick with you? You have ulcerative colitis and irritable bowel syndrome, that eat whatever the hell you want. Does that even intuitively make sense to you as a human being, not even as an RN?
No. And I looked at him, and it was when I told him that I was going gluten-free, and he was basically telling me that I was wrong. Yeah, I think I have other words for it, but I can't say. But yeah, I was the loony person for going gluten-free, and I was just like,
you know what? You know who's better now.
That's right.
Thank you. Yeah. All right. Point be taken. Thank you so much for being and sharing your knowledge and experience so generously. And I'm going to end this. Thank you, everybody, for watching this. And I hope this was helpful. And this is the discussion that you guys have all been asking for. So this is the insider's guide to what medical professionals choose when they have autoimmune disease themselves. Thank you, everybody.
Thank you.